East Midlands today here on the BBC, and a man who has lost most of his vision at the age of just 45 is campaigning to get more people tested for sight problems. Arunas Oshmaiga was diagnosed with advanced glaucoma. It turned his life completely upside down.
Well, now eye specialists at one of our biggest hospitals are urging people to make sure they have regular eye tests so that the condition is picked up early. Our health correspondent Rob Sissons has more details.
I want you to read the chart as much as you
Arunas can see virtually nothing out of one eye and not much out of the other. It's glaucoma, a condition that his specialist at Nottingham's Queen's Medical Centre says mainly affects older people, but he's seeing more younger patients these days, their cases detected sometimes late.
Glaucoma is a chronic condition that affects your optic nerve. Your optic nerve connects your eyeball to your brain, and it transmits important visual information from the retina to the visual centres located in the brain via electrical impulses. Now in glaucoma, the cells transmitting these electrical impulses become damaged due to raised pressure.
When it comes to our vision, we all have a blind spot. Here it's a black mark. As glaucoma develops, look how there are more black marks, more blind spots.
The patient is losing the top half of their vision and slowly beginning to lose the bottom half, where eventually these two halves meet up and then they eventually get tunnelling of their vision.
At home in Aspley, Arunas struggles to see his wife's paintings.
Yes, he's gave. Can you see those separate stones, how they look like? What he finds, that it's not only tunnel vision, but in that tunnel which is left, sometimes he sees like empty spaces already again, like plus to all of that.
Contrasting colours help, black for milk.
Of his tunnel vision, he can't see what is in front of him, and he can easily trash it down or swipe it.
Doctors stress we should all have regular eye tests at the opticians.
I recommend that all patients should have a check every 2 years after the age of 40. If they have a positive family history of glaucoma, they should go annually to the opticians.
Arunas is trying to stay positive.
To do something is more better than sit down. It's like...
Rob Sissons, BBC East Midlands Today, Nottingham.